Hello and good evening to our wonderful audience who is generally with us every time we go live on Saturday evenings. So that is 7 p.m. IST. And happy Pride month, everyone. On account of that, we have changed our logo to the rainbow colors on Twitter, Facebook, Instagram, and all on all social media possible. Please do see the new logo, and I'm proud to be associated with a brand and a teleconsultation team, which is Evrox Healthcare, which proudly celebrates Pride Month and is always, stands hand in hand with the LGBTQIA community all throughout the year, not only during the Pride Month. Okay, so today we have a neurologist on board, and today's topic is let us brainstorm. So, regarding that, today we are going to cover dementia, stroke, migraine, and epilepsy in part one. We also have part two, which will come up soon. Also, if you would like to see our new rainbow colored logo, please let us have that. Celebrate Pride Month. So, we have Dr. Dhruv Batra on board, who is a consultant neurologist and he's a specialist in movement disorders as well. But we will be covering the majority of movement disorders in part two. And today, as I already mentioned, we will be covering four major topics. So, please welcome Dr. Dhruv Batra on board.
Hi, thank you so much, Dr. Surbi and the Ebrox team for having me here.
Most welcome and thank you for accepting our invitation. So, which topic would you like to start with? Migraine?
I think that's the most common, and most of us are
Most
affected by migraine. I think that's great. We should start with that.
Even I am affected by that, so I would definitely want to know more about it. So what is migraine exactly? How do we define a migraine headache?
So it's very simple. See, I mean, many of our patients know that the word migraine. I mean, it's a headache. There's no doubt about it. But is it okay if I mix with Hindi and English? Is it okay for the audience if we mix match Hindi
Absolutely,
and English?
absolutely. Yeah, yeah.
So most of us know migraine to be a headache. Very simply, if I can put it, कि अगर मैं बहुत उसको सिंप्लीफाई करके आपको बताऊं, तो इट इज बेसिकली कि एबनॉर्मल ब्रेन में करंट्स का फ्लो होना, जिसकी वजह से हेडेक होता है. इट्स एज सिंपल एज दैट. जब करंट्स का फ्लो ब्रेन में, जो हम लोग इलेक्ट्रिसिटी की बात करते हैं, व्हेन द वोल्टेजेस गो वेरी हाई, इट मे प्रेजेंट लाइक अ सीजर व्हिच यू ऑल नो एज अ कन्वर्जन और अ फिट. बट व्हेन दे आर इन अ माइल्ड क्वांटिटी, if I may put it that way, in a mild amount, then it causes a wave of current across the brain, which may present like throbbing, like a pulsating thing, like somebody is knocking your head with a hammer. And that is what is basically migraine. It is a form of a headache. Usually, it happens on one side of the head, but sometimes it can happen on both sides also. And everybody has different severity of it. It is not everybody has the same intensity, and there is a lot of history also involved with it. Like if your parents have it, especially if your mom, so it's more common in females. If your parents have it, you have a higher chance of having migraine. Don't think of it as a disease, it is a tendency. There are some people who are migraineurs, which means they have a more tendency, or they are more susceptible or sensitive to triggers which may cause headache. And there are some people who are not so susceptible, so we don't treat it as a disease. It is just a condition, and it which is very easily treatable, let me tell you.
Okay, so now that you talked about triggers, so what can the triggers be like? I mean, they are different for different people, definitely, but what are the most common identified triggers?
Yes. Now, it is very important to identify the triggers. So, if our audience is listening, I would like them to pay attention, because if you can take care of your triggers, the biggest achievement that you can have, or you can achieve if you have migraine, is identify your trigger and then try to escape it. I usually tell my patients that migraine is just like you switch on the button for headache on your own. If you uh, don't escape the trigger, which means you are deliberately switching on the migraine button, and then, I mean, you are yourself bringing on the headache. And how do you expect somebody else to solve the problem for you? So, what I would suggest is the common triggers. I would like to divide it into, first and most common is the nutritional or food related triggers. See, anything that has cheese or wine or chocolate. These are very common. In diet, people may have Chinese food, if I may put it that way, which contains Ajinomoto salt. That is a very big trigger, monosodium glutamate. Apart from that, people have triggers like anything with preservatives. I mean, jam, sauce, anything which is used to preserve a food item, something which is a canned food or a tinned food. So all these things are triggers. So this is with regard to the food. This is the common. Then you have environmental triggers like smell. So strong smelling things like perfume, petrol, kerosene, turpentine oil, paint, anything. It can be glue. Anything which smells pungent can be a trigger. It can be a very strong, bright light when you go in the sunlight. That is a trigger. For ladies, for females, even menses every month are a trigger. And most important, which we come across in India, is fasting. You don't take food on time, you're empty stomach, and then you, anyways, at night, you are anyways empty stomach for 12 hours, and then you don't have breakfast. And that is the biggest trigger that we face. So, these are just some common triggers that I told you. Other than that, some people may have stress, lack of sleep, and these are the common triggers. So you should identify this, and if you can get rid of them, you will be I mean, I'm very sure you'll lose your migraine by more than 70-80%.
All right, all right. Thank you for that. I think I could identify some of the triggers myself.
Absolutely.
Yeah. So, moving on. Now, how does one, like for the common public, how does one identify that I may be having migraine? Because not all headaches are migraine. There are different types of headaches. So then, how does one identify that I may have migraine?
Yeah, that's a good question, because see, most of the times we tend to Google our symptoms, and if you put headache, it comes out to be migraine. But remember, migraine, as I told you, there has to be a trigger. There's something has to set it off. And usually, I'm putting in the word usually, it is one side of the head. It may be on both sides, but never together. One day it may be on the left, the other day it may be on the right, it may be on the back, but never together. And it is a pulsating nature. It's like something is pulsating inside you, like your veins or blood vessels are throbbing. That is a typical nature. And associated not only the headache, sometimes you may only have a nauseating feeling. मराठी में भी से मरमर होते हैं कि वहाँ उल्टी जैसा लगता है. And people sometimes vomit and then they feel better. So once you vomited, your migraine symptoms tend to go away. So nausea, vomiting, one-sided headache, usually pulsating in nature. Typical trigger: somebody has consumed alcohol, smoking. Even if you're not smoking, somebody close to you is smoking, and then you, because of passive smoking, you get the headache, and you can make this out. So this is what a typical migraine looks like. Sometimes you need to know that there is something called a migraine with an aura. Now, what is an aura? People, when they have a migraine attack, may notice blurring of vision. यानी उनको सामने अगर कुछ दिख रहा है, वो थोड़ी देर के लिए blur हो जाता है. It is a very small event. It may last for a few minutes, up to 20 minutes, and then again, as soon as the headache settles down, the blurring also goes away. So I'm not saying that every blurring is migraine, but if it is coming with a headache, going away peacefully in 20 minutes, it is usually a migraine with an aura. One more thing that you need to know is, some people describe zigzag lines. Like, for example, in a, you must have remembered that in childhood we play the rockets. दिवाली के rockets हम लोग खेलते हैं, और नाइट स्काई में जब वो रॉकेट zigzag जाता है, तो it leaves a trail of zigzag golden colored fire. So
True.
ऐसा zigzag sort of a movement in a dark background is seen with migraine patients. They get very afraid. I mean, what is this happening? Am I going to die or what? Is this a epileptic attack? But if it is associated with migraine, usually it is a migraine with aura. So you should remember these type of symptoms. And if you have any of these symptoms, you can consult a neurologist or a doctor, and it can be easily treated. And very rarely, remember, not all migraines are normal migraines. There can be sometimes dangerous types of migraines. If I have a couple of minutes, I'll just give an interesting example. This is a doctor from Nagpur. He was my colleague. He was a known case of migraine. But remember one thing, I think this is going to come up in the discussion later also, that how do you identify a dangerous headache or a dangerous migraine? So this fellow is a doctor himself. He knows his migraine. And he was on a flight to Spain for some conference. And he came back and he said that, boss, this is something different. I have had migraines for a very long time, but this headache seems to be little different. So change in character of the headache. A person who has migraine knows what his migraine is like. He knows it, what it is exactly like. He can identify it. But it is also important that you should know the change in nature. हमेशा जैसा नहीं है, कुछ तो इस बार गड़बड़ लग रहा है. हर बार 2 घंटे में ठीक हो जाता था, अभी 2-3 दिन हो गए ठीक नहीं हो रहा. सो दिस फेलो, आई टोल्ड हिम कि आपको ये अनयूजुअल है, इसमें आप एमआरआई कराओ, क्योंकि आपका लॉन्ग डिस्टेंस फ्लाइट रहा है. बहुत बार लॉन्ग डिस्टेंस फ्लाइट्स में पैर में खून जमा हो जाता है, विच वी कॉल डीप वेन थ्रोम्बोसिस. कभी कभी ब्रेन में भी हो जाता है. तो ही हैड दैट. उनके ब्रेन में ब्लड क्लॉट हो गया था, जिसको हम लोग सेरेब्रल वीनस साइनस थ्रोम्बोसिस बोलते हैं. सो what my point is कि don't neglect your headache if its nature has changed. It is not behaving as usual. So that is one more thing that you need to know. Yeah.
Okay, that was a very important information actually. I don't think a lot of people know about this. Okay, so moving ahead, I also wanted to ask, like, generally associated with migraine, we talk about photophobia and phonophobia, and a lot of people don't understand what that is. So, could you please tell the audience in simple words what is photophobia, what is phonophobia, and how it is associated with migraine?
Yeah. So the thing is that I think these are just medical terms, but if I explain it to you in a layman language, almost all of you will identify कि हाँ हमारे साथ ऐसा हुआ है. What is photophobia? Photo means light, phobia means डर or fear. So not fear, but they are very sensitive. So if somebody is having a migraine attack, and if he is exposed to bright lights, he will have very severe. It is like it will be more painful for him, because your brain has already become very sensitive. Your receptors have become very sensitive. As I told you, migraine is an electrical phenomenon. Your brain is already having some electrical activity going on, and on top of it, if you give more electrical activity, like a electrical input like light, or when you say phonophobia, that means sound. So if you give auditory electrical stimuli, or if you give visual electrical stimuli, it is going to worsen his headache. He may feel more irritable. And these also are some important factors which help us to identify whether the patient is having a migraine or not. So they will tell you कि हमें आवाज सहन नहीं होती. Children, women who have young kids, they will tell you that बच्चों के रोने की आवाज हमें बहुत चिड़चिड़ होती है, मतलब हम लोग नहीं सहन कर पाते. या घर में बर्तन धोने की आवाज आ रही है, या अगर बहुत टीवी में ब्राइट लाइट है या धूप में जाना है, so वो हमको सहन नहीं होता है. We are very irritated by it. So that is what is phonophobia and photophobia. Nothing more.
Okay, okay. And a lot of people, they tend to self-medicate once they have a headache or they have some sort of a body ache or some pain in their body anywhere. तो चलो आज एक पैरासिटामोल ले लेते हैं, डाइक्लोफेनाक ले लेते हैं, कुछ ना कुछ एनाल्जेसिक किसी ना किसी के घर पे होता ही है. तो what is I mean, what would you advise the public, that should they self-medicate during migraine or they should see a doctor, and what exactly would be your advice?
See, that is a very important point that you brought up. This is the biggest problem, I think. I mean, this is the biggest problem in India, wherein over-the-counter drugs are very common, and you can basically get anything without a prescription if you know the local pharmacist. Now, the pharmacist gives it to you out of goodwill, but in the long run, this is not a goodwill. This is going to create problems for you, and let me explain why. See, चलो आज एक बार ले लेते हैं is good, but रोज ले लेते हैं is bad, and there are limits to what you can take. So, for example, if you have something as simple as a paracetamol, सबको पता है, सबके घर में paracetamol है, क्रोसिन है, डोलो है. If you take paracetamol more than 10 to 15 times a month, you end up at a risk of having what is known as medication overuse headache. Now, the problem is, this is a headache which is going to stay. It is not going to go away. It is because you have overdosed yourself on medications. Now this is no more a migraine. This is now transformed into a medication overuse headache. अब क्या करोगे? अब आपकी बॉडी उसको रेजिस्टेंट हो चुकी है. तो आप जो दवाई ले रहे थे, अब वो काम तो करेगी नहीं, पर आपका सरदर्द भी नहीं जाएगा. नाउ यू आर इन अ लिम्बो कि अब मैं क्या करूं, सरदर्द भी हो रहा है, दवाई भी काम नहीं कर रही है. तो इस सिचुएशन से बाहर निकालना बहुत डिफिकल्ट हो जाता है. सम पीपल नीड टू बी एडमिटेड. उनको बहुत पावरफुल दूसरे ड्रग्स देने पड़ते हैं टू वीन देम ऑफ, सॉर्ट ऑफ रिहैब. यू हैव टू डी एडिक्ट देम फ्रॉम देयर माइग्रेन मेडिसिन का एडिक्शन विच दे हैव देमसेल्व्स ब्रॉट अपॉन देमसेल्व्स. ये तो पैरासिटामोल की बात होगी, पैरासिटामोल इज वेरी सिंपली अवेलेबल इन इट्स ओके, बट व्हेन यू स्टार्ट टेकिंग हायर पावर ड्रग्स, नाउ देयर इज अ ड्रग कॉल्ड सुमाट्रिप्टान, जिसको हेडसेट नाम से मिलता है या बहुत नाम से मिलता है, एंड आई एम एक्चुअली वेरी अनहैप्पी द वे इट इज बीइंग गिवन आउट बाय द फार्मासिस्ट और पीपल without knowledge, that you cannot have headset or sumatriptan more than 2 tablets in 24 hours, and people are taking it daily, thrice a day, twice a day. These people are at a very high risk of medication overuse headache, and let me tell you, they end up being miserable, and then they regret, because now stopping the medicines is not going to help. They have to go into an extensive rehab, and then you have to detoxify them. Sometimes it will be successful, sometimes it may not be. So it is, I would really, anybody who is listening to me as a friend, I would advise you, don't take any migraine or paracetamol or any other drugs without your doctor's consultation. Okay, fine, you've taken it in an emergency, रात को 12 बजे दर्द हो रहा था, आपने ले लिया, कोई बात नहीं, एक दो दिन ले लिया, ठीक है, बट उसके बाद उसकी आदत मत लगाओ। ऐसे जिनको बार बार लेना पड़ रहा है, दे आर कैंडिडेट्स फॉर प्रिवेंटिव थेरेपी। मतलब आई विल गिव यू अ मेडिसिन विच यू कैन टेक डेली टू प्रिवेंट द माइग्रेन। वो होना ही नहीं चाहिए आपको, क्योंकि आप अगर डेली होके डेली पैरासिटामोल लोगे तो यू आर अ कैंडिडेट की 2 महीने में भाई आप मेडिकेशन ओवर यूज हेडेक वाले कैंडिडेट बन जाओगे, फिर आपकी तकलीफ शुरू हो जाएगी। तो ये चीज ध्यान रखिए।
All right. So I think I also got to learn a lot of from this. Okay, so there is a question: is there a role of serotonin level in migraine?
So should I answer that? Yeah.
Yeah, yeah.
Right. Yeah. So the thing is that, see, Sanjeev has asked that is there a role of serotonin level in migraine? Now uh, see serotonin. I cannot go into too much details because of the paucity of time, but serotonin is a chemical in the brain which is usually associated with depression. So people who have a low level of serotonin usually have depression, and all the medications that are given for depression will improve the levels of serotonin in your uh, system, in your brain or in the. And people who have depression are the ones whose migraine is less likely to go away early. So let's say somebody who is coming to me with migraine, and I'm giving him all the routine migraine treatment, and he's not getting better in spite of the trigger, in spite of the treatment, in spite of everything, then this fellow, I have to ask whether भाई आपको डिप्रेशन तो नहीं है, या मतलब you have to evaluate। वो खुद आके नहीं बोलेगा मुझे डिप्रेशन है, हमें उसको क्वेश्चंस पूछ के पता करना पड़ेगा, कभी कभी साइकेट्रिस्ट की हेल्प लेनी पड़ेगी लाइक सुरभि, कि whether you have depression or not, and then very carefully we have to start him on antidepressants, and there are so many patients who are doing very well once their depression goes away. So at the end of the day, the answer is yes, there is a role of serotonin in migraine, and there is no point in doing a level. It is basically your symptoms which guide us. Usually we never do a serotonin level in the blood कि भैया लो है तो ट्रीट कर दो, बिकॉज नहीं, सीरोटोनिन का काम ब्रेन में है, ब्रेन में जाके तो नहीं निकाल सकते सीरोटोनिन का लेवल, और ब्लड में उसका यूज इतना है नहीं। और बहुत सारे ब्रेन में रिसेप्टर्स हैं जो सीरोटोनिन के रिसेप्टर्स होते हैं, जो ब्रेन के बहुत सारे कामों को, जैसे लेट मी गिव यू एन एग्जांपल, जब माइग्रेन के समय वॉमिटिंग होता है ना, तो जो रिसेप्टर इन्वॉल्व होता है ना, जो केमिकल, वो भी सीरोटोनिन का ही होता है। तो हम लोग जो मेडिसिन देते हैं ना, जैसे ऑनडेनसेट्रॉन दे दिया या ऑनडेम दे दिया, ये सीरोटोनिन रिसेप्टर पे ही जाके काम करते, तो डेफिनेटली रोल है।
Right. Sanjeev, I think that answers your question. And again, I got to learn something more about migraine based on serotonin levels as a psychiatrist. So thank you, Dr. Dhruv, for that. So now I am done with my questions regarding migraine. Would you like to summarize migraine?
I think we've answered. I mean, we also have some other topics to discuss. So what I'll just say is,
Yeah.
don't treat your migraine on your own. Don't Google it. Consult a specialist. Get it sorted out in the first visit itself. यूजुअली नहीं होता है क्योंकि सर दर्द सबको ही होता है, बट एटलीस्ट जब आपको, रिमेंबर वन थिंग, अगर आपको आपका माइग्रेन महीने में 4 दिन से ज्यादा तकलीफ दे रहा है, 4 दिन से ज्यादा मतलब जिस दिन आपको माइग्रेन हुआ उस दिन आपका दिन बर्बाद हो गया, आप अपना काम नहीं कर पाए, आप अपनी लाइफ नहीं एंजॉय कर पाए, आप बस घर में लाइट बंद करके बिस्तर पे सो रहे हो, सर दर्द से दूर पैरासीटामोल खा रहे हो दिन में 4-5 बार, ये होता है 1 डे, मतलब 1 अटैक। ऐसे अगर आपको महीने में 4 अटैक से ज्यादा आ रहे हैं, So please consult a neurologist. Get rid of this misery. It is very easily possible and it will help you a lot. आपकी life में आपको बहुत खुशी मिलेगी. Just remember this. बाकी we can have later on, maybe you can mail us questions, or we are there in the next episode also, and we can interact. I mean, that's not a problem. Yeah,
Yeah, so you can even like ask questions by the end of today's session or in the next session, even related to today's session. It's not an issue.
sure.
Okay, so the next topic that we have today is epilepsy. So, what is exactly a seizure, and how does one identify a seizure?
See, epilepsy is a big problem in India. I'll be very brief, very straight. It is a big problem. Important thing that everybody here needs to know is don't neglect it. Don't think that this is some result of your previous life का sin और पिछले जन्म का पाप है या देवी चढ़ गई है. Don't do it. I know it looks funny, but it happens. And you have all these epilepsy guys who have kala dhaga kaan mein and kala dhaga everywhere, and there's so many malas and everything from all mandirs across India, from all devis across India. So you do it, but at least consult a doctor, because see, epilepsy is treatable. I'm not saying it is curable, but so is diabetes, hypertension. These things are not curable, but it is treatable. You can make your life good with it. So what is epilepsy is basically seizures means fits. Fit में क्या होता है? You become unconscious. You may have, if you can look at me, your eyes go up like this. You may have a jerky movement of the hands. You may have bite. You may have a tongue bite. You may have frothing. झाग निकल के आता है मुंह से and neck ऐसा एक जगह twist होके ऐसा 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 कि you fall down. So this is what a typical fits look like. But sometimes you may have, this is especially for if you have kids or if somebody has young kids at home. It is very common for school teachers to complain ki when your child is in school and they say that he continuously blinks like this and he doesn't pay attention, or he is just staring into the blackboard without paying any attention, and his attention span is very poor in the class, and he's been doing very poorly on his exams and academics. Don't neglect it. It could be something called absence epilepsy. Sometimes you have kids in the morning when they get up, उनके हाथ में brush होता है, and they suddenly there is a jerk and the brush falls off. Or in the morning when they're having their glass of milk or Bonvita or whatever, suddenly there is a jerk or it falls off and parents are like, तुमको दूध नहीं पीना है इसलिए तुम ऐसा कर रहे हो, उसको डांट डपट के, ये तुम्हारे बहाने हैं, you don't want to drink milk, that is why you are doing this. Don't neglect it. Early morning jerks can be a sign of future epilepsy also. So this is, I'm just giving brief examples that if you have any sort of these symptoms कि पूरा unconscious हो गए, jerks are unexplained, आंखें मिचमिचा रहे हैं या स्टेयरिंग लुक है या अचानक चक्कर आके बार बार गिर जा रहे हैं. आई एम नॉट सेइंग कि हर चक्कर इज एपिलेप्सी, बट अगर चक्कर आके कोई बेहोश हो जा रहा है और उसको याद ही नहीं आ रहा कि क्या हुआ था मेरे साथ, तो देन इट इज वेरी लाइकली दैट you are dealing with epilepsy. So it should be consulted. You have to consult a specialist. So that is one. Epilepsy can come in various forms. Most important thing, I think, there is a question, I mean, Survi is going to ask this, but I think I'll cover it right now if it's okay. What you should do if somebody has a seizure. Now,
True.
if somebody has a seizure in front of you, यानी हाथ पैर ऐसे 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 हो गए, जीभ कट गई, मुंह से झाग आ रहा है, आंखें ऊपर वाइट हो गई हैं, and he's just twisted like this and he's just shaking, don't panic. First thing, just give him a safe place to lie down, preferably put a pillow under the head, turn him on one side. I'll repeat this, this is extremely important. Turn the patient preferably on the left side, and again I'll repeat, don't put anything in his mouth. Don't give him a sip of water. He's not going to die if you don't give him water, but he can die if you give him water. And don't put any metallic object in the mouth, because बहुत बार होता है कि लोहा छूने से या ये करने से रुक जाता है. द जॉ इज सच अ स्ट्रॉन्ग थिंग. अगर डालने के इसमें आपका हाथ बीच में आ गया तो आपकी उंगली कट जाएगी, और वो मेटल का या प्लास्टिक का कुछ डालने जाओगे वो क्रश हो जाएगा, उसके गले में अंदर चला जाएगा, लंग्स में. तो मुंह में कुछ भी मत डालिए, पानी तक नहीं देना है, एक साइड पे लेटा के रखना है, भीड़ नहीं करना है, उसको ऑक्सीजन सांस लेने के लिए स्पेस देना है, और उसका टाई बटन या जो भी है वो लूज करिए, उसको हवा मिलने दीजिए, और विद इन 5 मिनट्स उसको होश आ जाएगा. अगर 5 मिनट्स में भी होश नहीं आता है, तुरंत हॉस्पिटल में उसको लेके जाके एडमिट करना है. तो इतना आप याद रखिए. दिस इज व्हाट इज ब्रीफ अबाउट फिट्स एंड व्हाट यू शुड डू इफ इट हैपेंस इन फ्रंट ऑफ यू.
आई थिंक इसमें सबसे इम्पोर्टेंट ये है जो आपने कवर किया, जो एक्चुअली मिथ है, लोगों को लगता है कि पानी पिला देना चाहिए या कुछ मुंह में डाल देना चाहिए. सो इट वाज वेरी इंपॉर्टेंट दैट यू टोल्ड दिस टू द
Yeah.
ऑडियंस दैट नो, यू नॉट सपोज टू डू दैट एट ऑल. ओके. सो आपने कहा कि 5 मिनट तक के अगर हो जाता है, इफ इट्स ओवर देन इट्स फाइन, अदरवाइज हॉस्पिटलाइज, राइट?
Yeah.
सो so now we come to status epilepticus. So what is that? And अगर ज़्यादा देर तक होता है तो उसकी क्या क्या प्रॉब्लम्स हो सकते हैं और लोगों ने क्या करना चाहिए?
That brings up to a very important question. See, status epilepticus matlab a fit which is refusing to stop. The body is made in such a way, the brain is made in such a way with God's grace, you cannot continuously keep it in a full electrical mode for more than 5 minutes. So it will auto switch off. It's like a protective mechanism कि आजकल गाड़ियों में जैसा आता है ना कि if you're speeding the गाड़ी will slow down whatever. So if the brain is continuously having fits for more than 5 minutes, most of the time it will shut down on its own. The patient will become unconscious and gain consciousness within 15-20 minutes. But if the patient is just not having this seizures, this movement, this twisting, this jerks, if they are not stopping in 5 minutes, which means there is a problem. The auto regulation mechanism of the body has gone for a toss. कुछ तो गड़बड़ है. Or if you don't stop it, his life can be at risk. And let me tell you why. Whenever somebody is having a seizure, a lot of things are happening in the body. The heart tends to stop for that period of time. Usually it is for seconds, which we call asystole, which means the beating of the heart is temporarily stopping. But then as soon as the electrical activity reduces, the heart starts to beat again. This is what happens normally. But just imagine if your electrical activity refuses to stop, your heart may refuse to start back again. Now this is basically a sort of a cardiac arrest. So don't forget this. And sometimes if somebody is continuously seizing, he may have fractures. His muscles may burn. Continuously agar seizures aa rahe hain, to muscles are on fire. So muscles may burn. The problem is if the muscles burn, they leak proteins. And if they leak proteins in the blood, it all goes into your kidney and destroys your kidney. The patient may have a permanent renal failure. The kidney may shut down. So all these problems can happen anytime. So I cannot enumerate all the complications in a short time. But the point is, if the patient is not stopping seizing within 5 minutes, it is likely to be something which we call as a status epilepticus, which is a medical emergency. This patient needs to be admitted in the hospital as soon as possible.
All right. I hope that's clear to everyone. So, can people with epilepsy, have, can they lead a normal life?
Absolutely. I mean, see, I mean, this is just the, I mean, some, I don't know, कुछ बीमारियों को इतना ऊंचा दर्जा दे दिया गया है कि उनको बाकी से वो खुद से बड़े लगते हैं, मतलब बाकी बीमारियों से. There are so many people who live with sugar, diabetes, hypertension, right? I mean, nobody questions them. But when it comes to epilepsy, oh my God, इसका क्या होगा? क्या ये शादी कर पाएगा? क्या इसके बच्चे होंगे? क्या इनके बच्चों को epilepsy हो जाएगी? I mean, the chances of somebody dying with epilepsy is 1,000 times of somebody dying on a road traffic accident on the road. But we don't stop driving. We drive, right? I mean, there is no relation. I mean, see, epilepsy, people who are well controlled on epilepsy with medications, they can marry, they can do all their jobs, unless, I mean, there are some very high risk professions like driving an aeroplane, flying an aeroplane. Even the government has come up with guidelines that if you're seizure free for a certain period of time, you can drive on the road. You need to be careful with certain high risk professions like some machinery industries where you're working with extremely dangerous machines. That is somewhere you need to be careful. For example, if somebody is a swimmer, he needs to be careful. But other than that, they can do everything. Just take your medicines regularly. Remember, epilepsy does not come in a single solo packet. It comes with multiple other problems like depression, anxiety, little bit of intellectual disability, little bit of difficulty in doing your studies. So that all has to be checked by a specialist. Many times, psychiatrists like Surbi helps us out with the psychiatric angle of epilepsy. So all these things need to be done. But remember, they can marry, they can have normal kids. It is not, there is no correlation. Less than 10% of epilepsies are genetic. So 90% of them are routine stuff, not genetic. So all these going to children and other things don't come into the picture. Yes, 10% of them can be, but you have to consult your doctor, and not all genetic problems are transmitted to your children. And many people are doing very good work. Famous people, John T. Rhodes. All of us know about John T. Rhodes. You know how beautifully he fields
Oh,
the
the
ball.
best fielder. Yeah.
Yeah, but do you know he had epilepsy? No. So he is doing fine. I mean, one of the best commentators, Tony Gregg. We've all grown up listening to his commentary in cricket. Unfortunately, he's no more. But he had epilepsy. The great Julius Caesar conquered all of Rome and the world and everything. He had epilepsy. So I'm just telling you that it is not something like a, don't take it as a taboo or a stigma. Epilepsy can be treatable. I mean, even Leander Pace, he had a brain infection which causes epilepsy, but he is fine. He won a bronze medal for India in the Olympics. He was doing fine till now. I mean, great sportsman. So don't worry.
Oh, I did not know about so many famous people having epilepsy.
Yeah.
Very nice information. Thank you for that. So, I think we have almost covered the majority things about epilepsy, but I think lastly we should also add about the additional superstitions that people have related to it and what the real facts are.
Yeah. So, I mean, superstitions, I think we've covered that. Don't, I
Yeah,
mean,
we did.
like, especially the don't put anything in the mouth, don't put keys in their hands. अनफॉर्चुनेटली उसको बेचारे को फिट्स आ रहे हैं और आप वो गंदा मोजा उनको सुंघा रहे हो, बैड स्मेलिंग, उससे कुछ नहीं होने वाला है. और प्याज सुंघा रहे हो या हाथ में प्याज रख रहे हो, ऑल दिस इज सुपरस्टिशियस, सो डोंट डू इट. इट इज नॉट गोइंग टू हेल्प. यू कैन डू इट, बट इट इज नॉट गोइंग टू हेल्प. Second, again, as I told you, a lot of myths associated with it. It is a medical problem. It has got nothing to do with your child, whatever sins or whatever जो बोलते हैं देवी चढ़ गई है, तो झाड़ फूक करने के पीछे मत पड़िए, अननेसेसरी नुकसान ही होगा आपका. मेडिसिन रेगुलर लेना है, आपके डॉक्टर के कंसल्टेशन में लेना है. आजकल एपिलेप्सी के लिए बहुत सारी अच्छी फैसिलिटीज आ गई हैं कि नाउ डेज देर इज एपिलेप्सी सर्जरी ऑल्सो. सो इफ यू आर अ कैंडिडेट, मतलब इफ यू आर अ करेक्ट कैंडिडेट, that the doctor will decide कि भाई आपको एपिलेप्सी सर्जरी से फायदा हो सकता है, then you should go ahead for it, but let your doctor decide. And many patients, if they are the correct candidates for epilepsy surgery, they can even, उनकी medicines भी बंद हो गई है या उनकी डोज मोर देन 90% कम हो गया और 3 साल में मेडिसिन फ्री हो गए, मतलब लाइफ लॉन्ग अब वो नॉर्मल हो गए. तो देर आर लॉट ऑफ ऑप्शंस. पर अगर आप सही जगह जाके, इफ यू टेक ओपिनियन, यू कंसल्ट द राइट पीपल, यू कंसल्ट अ न्यूरोलॉजिस्ट, you will be in good hands, don't worry.
Correct. So, we do have a question from Mohit Latta. If a lady is pregnant with epilepsy, does it get transferred to the fetus also?
No, 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 no. See, the this is, it is not transmittable. Okay, it's not transmissible illness. नहीं है. It is not some infection. हाँ, unless it is some infection which is getting transferred and causing epilepsy. But broadly, epilepsy does not get transferred to the fetus. Uh, Again, I have told you that there are very few genetic conditions, less than 10%, कि मदर को भी है तो बच्चे को भी होगा, but that is a rarity. सो डोंट गो बाय दिस थिंग कि माँ को है तो बेटे को भी होगा. जितना चांस, अगर जैसे फॉर एग्जाम्पल एक नॉर्मल पेरेंट्स, मतलब जिनको मदर फादर को एपिलेप्सी नहीं है, उनके बच्चे को जितना फिट आने एपिलेप्सी होने की चांसेस है, उतना ही चांस एक प्रेग्नेंट लेडी जिसको एपिलेप्सी है ना, उसके बच्चे को है. इतना आप याद रखिए, फॉर मोर देन 90-95% ऑफ द केसेस. तो और एपिलेप्सी के बहुत सारे कॉजेज होते हैं. अगर किसी को बचपन में हेड इंजरी हो गई, इंडिया में ब्रेन में इन्फेक्शन, टीबी, ब्रेन का जो एक हम लोग कीड़ा बोलते हैं उसको न्यूरोसिस्टिक सर्कोसिस बोलते हैं, अगर वो हो गया आपको, तो ये सब ट्रीटेबल है. तो किसको क्यों एपिलेप्सी हो रहा है ये पता करना बहुत जरूरी है. इसीलिए अगर आप सही जगह अपनी राय लेंगे तो यू विल बी मतलब गाइडेड प्रॉपर्ली, रादर देन फिर ये सब ब्लाइंड प्रॉब्लम, मतलब ये सब जो मिथ्स प्रोपेगेट होते हैं ना, फिर उससे तकलीफ होती है.
Right. We also have another question related to the same. Which proteins should be eaten because of this? Okay, I think
Uh,
he means that when somebody has epilepsy, तो उस टाइम पे क्या खाना चाहिए?
so see, there is no one important point I will bring up here is he has mentioned proteins, but I'll just modify it. See, there is some one part of treatment in epilepsy called ketogenic diet. So you must all have heard about it because many of these days it is very popular. Keto diet, keto diet.
Yeah.
for people who are losing weight or gymming, whatever. But the ketogenic diet is something which is a treatment in some types of epilepsies. So, but it is not something that can be done at home. It is a very strict protocol that has to be done in hospital when you start it for the first time. And why I'm saying this is, all of us know कि हमारे सबके खाने में कार्बोहाइड्रेट, प्रोटीन और फैट होता है ना? तो ये हम लोग नेचुरल जो खाना खाते हैं उसमें वो बराबर कंसंट्रेशन में रहता है, 60-70% कार्बोहाइड्रेट्स, 20-30% फैट और 20-30% प्रोटीन. बट जिनको ये कीटोजेनिक डाइट देना पड़ता है उनमें थोड़ा सा फैट की मात्रा बढ़ जाती है और बाकी की चीज़ें कम हो जाती हैं. तो इससे बॉडी में बहुत सारे मेटाबॉलिक या केमिकल चेंजेस होते हैं जो मॉनिटर करना बहुत ज़रूरी है. सो कमिंग टू डाइट, again your doctor will tell you whether you are a candidate for ketogenic diet or not. Usually it is reserved for people who are not doing well on medications. Again, it is reserved for people who have very specific conditions, like there is a list of 10 or 12 genetic conditions. Once they have been genetically proven, only then you can start the ketogenic diet, and most of the times in children with epilepsy. But again, as I said, प्रोटीन का रोल नहीं है, कीटोजेनिक डाइट का रोल है, बट वो भी डॉक्टर की गाइडेंस और डाइटिशियन जो इसमें एक्सपीरियंस्ड है उसके गाइडेंस में.
Okay. I hope that answered your question regarding the diet that should be followed if you have epilepsy, but at the same time, do consult the doctor first. Okay, so the next topic that we are going to have is stroke. Now, a lot of people have this, a myth in their mind कि stroke generally लोग heart attack को बोलते हैं और myocardial infarction को बोलते हैं. But stroke is basically a neurological condition, and we have Dr. Dhruv to answer about that. So, Dr. Dhruv, what is a stroke? How do we identify a stroke?
That's a very pertinent question, especially if I tell you that in India, as we speak, 7,000 to 10,000 people every day are getting stroke. So, I mean, if you divide it in the last 1 hour or so, if half an hour we've been speaking, maybe 15 to 30 people have already got stroke. The problem with what is stroke? Stroke is basically a brain attack, and that disables you. If you have a heart attack, you have chest pain, but then that's all there is. I mean, I know it's a life-threatening condition, and if you get in time, and if you consulted a cardiologist, and if he's treated you, you're fine. But problem with a brain stroke is you can lose your limb, you can lose the ability to speak, and for life. And in brain is such a valuable organ that a recovery in brain problems is very slow. So the best way is to prevent it. So prevention means what? Like a good, I mean, everything that you would do for preventing a heart attack, like avoid smoking, control your blood pressure, diabetes, take healthy diet, at least half an hour or 45 minutes of exercise every day, lose weight if you're obese, all this stuff. I mean, that's a long discussion, but the point is, whatever you do to prevent a heart attack is the same thing for a brain attack. But what is even more important is how to identify it in time, because more than 80% of the strokes, if they are identified within time, which we know as a golden period or a window period, it is it gives very good treatment is available. But unfortunately, if you lose that precious time, remember, time is brain. If you lose that time, you lost it forever. I mean, there's nothing more you can do. So I will very briefly tell you how to identify whether somebody has a stroke or not. See, remember this acronym, be fast. So if you have to prevent, or if you want to prevent the lifelong repercussions or damage of stroke, you have to be fast. So be fast. So BEFAST. That is be fast. So B stands for balance. If somebody is losing balance suddenly, सुबह 8 बजे तक ठीक थे, 8:05 को उनका बैलेंस जाने लगा. ठीक है? So this is what that typical stroke looks like. It will be sudden. The person will tell you exactly the time when it happened because it is so catastrophic. So that is one more marker. If somebody asks me आपको कब से सर दर्द हो रहा है, तो मैं बोलता हूँ यार 2 घंटे 3 घंटे से या कल से हो रहा है. बट अगर किसी को स्ट्रोक हुआ ना, तो वो आपको टाइम बताएगा, क्योंकि सबसे पहले वो टाइम देखता है जब स्ट्रोक होता है. तो तो 8 बजे तक ठीक थे, 8 बजे से अचानक उनका बैलेंस चला गया, तो बी फॉर बैलेंस. ई इज फॉर eyes, so sudden loss of vision in one eye. Usually in stroke it will be one eye, not both eyes together. Sometimes it can be both eyes, very rarely, but usually one eye. So B, E. F is for face. So एक तरफ face is like twisted like this, so one side has become weak, जिसको facial weakness बोलते हैं. F. A is for arm or leg, which means sudden loss of power or weakness in one arm or the leg. एक हाथ एकदम कमजोर पड़ गया, लूज पड़ गया, उसमें बिल्कुल ताकत ही नहीं. S is for speech. Speech means आवाज, आपकी बोलने की ताकत. So it becomes slurred, like somebody has मतलब alcohol पी के बात कर रहे हैं. So it is like this. Suddenly आवाज change हो गया. So that is speech. And T is for time. So time is most important. If you can get this patient under 3 hours, इसका मतलब ये है कि as soon as possible. ऐसा नहीं कि 3 hours है तो अरे चलो अभी बहुत टाइम है आराम से ले जाएंगे, ऐसा नहीं है. जितने जल्दी आप उनको लाएंगे उतना ज़्यादा उनका ब्रेन हम लोग सैल्वेज कर सकते हैं. एंड रिमेंबर, विथ एवरी 1 minute ऑफ स्ट्रोक होने के बाद हर मिनट में millions and millions of neurons are getting damaged, which is never going to come back. It is like the ice, it is like the brain is melting. It is not going to come back with every passing minute. So it has to be urgent. रात को 2 बजे हो रहा है तो मत रुकिए आप कि भाई कल सुबह ले जाऊंगा, नहीं, ऐसा नहीं. रात को 2 बजे लेके आइए. So be fast, याद रखिए. This will help you to identify a stroke. I will repeat it for the clarity. B is for balance, E is for eyes, F is for the face, A is for the arm or leg, S is for the speech, and T is for the time. Less than 3 hours, patients will do well if it is those 80% of those strokes.
Wonderful, wonderful information, Dr. Dhruv. And I think it is very, very clear for the audience that they have to be fast. And I think the full form is also very, very understandable to them. So, wonderful. I mean, wonderful elaboration. Okay, so we did talk about the golden period. You told about how to identify a stroke and how fast a person should be. But at the same time, the audience would also like to know whether it is really treatable. I mean, say for example, 3 hours के पहले आप 80% salvage कर पा रहे हो. That is what you said, right? But 3 hours के बाद, is it treatable? And is it like completely life threatening after that?
No, no. So I'll just clarify a couple of points. See, there are two types of strokes. One is the ischemic stroke, मतलब brain में blood supply block हो गया. So this is what I meant कि 80% of the strokes are this, कि जिनमें brain में blood
हाँ,
supply block हो गया. तो इनको जितना जल्दी आप ला सकते हैं उतना
right.
जल्दी हम इनको we can save them. जो बचा हुआ 20% है, that is bleeding. तो ब्लीडिंग में क्या होता है ना कि
Yeah,
वो
hemorrhagic
टाइम का
strokes.
उसका इंपॉर्टेंट, एनी स्ट्रोक यू हैव टू ब्रिंग एज सून एज पॉसिबल. बट ब्लीडिंग में ये वो विंडो पीरियड और गोल्डन पीरियड और वो क्लॉट निकालने का नहीं रहता है. द ट्रीटमेंट रिमेन्स द
Right.
सेम, आप 3 घंटे में लाओ या 6 घंटे में लाओ. बट ये सिर्फ 20% है. हमको जो मेजोरिटी बल्क है 80% कि जिसमें वहां आर्टरी ब्लॉक हो गई है, वो आर्टरी का ब्लॉक हमको ओपन करना है. अभी ब्लॉक ओपन करना है मतलब वो एक इंजेक्शन में दवाई देके भी हो सकता है. अगर आप 3 घंटे के अंदर लाते हो तो हम एक क्लॉट डिजॉल्विंग इंजेक्शन देते हैं, जिससे वो क्लॉट डिजॉल्व हो जाता है और वो ब्लड सप्लाई खुल जाता है. पर आप जितना लेट लाओगे उतना वो क्लॉट टाइट होता जाता है, ऑर्गेनाइज होता जाता है, तो वो खुलता नहीं है फिर. पर इसका मतलब ये नहीं कि आप पेशेंट को ट्रीटमेंट नहीं दे सकते. आजकल 3 घंटे के बाद भी अगर आप लाओगे तो नई नई डिवाइसेस आ गई हैं जिससे हम ब्रेन में वायर डाल के वो क्लॉट को पुल कर सकते हैं. तो ये पेशेंट्स का ट्रीटमेंट तो 8 घंटे तक भी हो सकता है. इसीलिए ज़्यादा रुको मत. जैसे ही आपको बी फास्ट नज़र आता है आंखों के सामने, पेशेंट को तुरंत हॉस्पिटल लेके जाइए. एंड रेस्ट ऑफ द थिंग्स द डॉक्टर विल टेक केयर, और आइडियली शुड टेक केयर. ओके, प्रिफरेबली टेक द पेशेंट टू अ प्लेस वेयर अ सीटी स्कैन इज अवेलेबल. दैट इज गुड इनफ. And nowadays, in all places, even small taluka places also, everybody has a CT scan. That is not a problem. You don't need an MRI or hi-fi stuff. You just need a plain CT scan. It takes 2 minutes to do a CT scan to identify whether you are 80% or 20%. And then from there on, this treatment is injection is also available everywhere. And just let me highlight a point. Let's say you are far away from a hospital. Let's say you are in a taluka place. You are like in Gondia, or you are in some distant place away from Nagpur, or I mean anywhere. Let's say away from a major city. Don't wait. The treatment is available with all doctors. Do the CT scan, take the treatment, and then you can shift the patient to a higher center. That will save time. Don't waste 3 hours in traveling. Take the treatment and then travel. This is what we call as drip and then ship. So remember, drip and ship. Don't waste time in taking the treatment. That can be taken anywhere. आजकल टेली कंसल्टेशन भी अवेलेबल है, ऑनलाइन कंसल्टेशन भी अवेलेबल है, तो वहीं के वहीं लेके दवाई ले लो, इफेक्ट आ जाने दो, फिर आप ट्रैवल करो. सो रिमेंबर दैट.
Okay, very brief, precise, and important information. We do have a question related to stroke by Vaibhav Thackeray. Is there any possibility if an individual had a stroke and it goes unnoticed?
Absolutely, absolutely. We have so many people because what happens is you are not aware. I mean, if somebody told me that अभी मैंने आपको बता दिया, बट कभी कभार ऐसा हो सकता है ना कि आपकी एक 10 मिनट के लिए एक आंख में रोशनी चली गई पर वो वापस आ गई, तो देन यू थिंक दैट अरे कुछ मतलब शायद मैंने खाना नहीं खाया, हाइपोग्लाइसीमिया हो रहा होगा. यू टेंड टू, दिस इज अ ह्यूमन वे ऑफ रैशनलाइजिंग इट ना कि भाई कुछ तो ऐसे ही हुआ होगा, चलो ठीक है, देन यू निग्लेक्ट इट. बट दिस इज व्हाट इज नोन एज अ TIA, मतलब वो मिनी स्ट्रोक बोलते हैं उसको. एंड देन इट मे कम अप इन अ बिग मैनर एंड इट हैपेंस मेनी टाइम्स. अनलेस दे गो टू अ डॉक्टर यू विल नेवर नो कि क्या हुआ था. बहुत बार पीपल से कि समटाइम्स व्हाट हैपेंस कि वीकनेस नहीं होता है, एक हाथ में सिर्फ टिंगलिंग होता है. जैसे मराठी में बोलते हैं एका हाताला मुंगी आली किंवा हाथ में झुंझुनी आई, तो वो झुंझुनी सबको लगता है कि अरे ऐसे ही हुआ होगा, बट इट कैन बी अ साइन ऑफ स्ट्रोक. एंड मेनी टाइम्स पेशेंट्स को अगर नींद में होता है, सो दे डोंट कम टू नो. बाय द मॉर्निंग दे आर फाइन, बट रात में होके चला गया. तो इसका हम लोग को बहुत बार आगे चल के जब व्हेन वी डू एन MRI या वी डू अ ब्रेन स्कैन, देन वी कम टू नो कि हाँ इनको मे बी लास्ट कपल ऑफ ईयर्स में एक बार ऐसा हुआ है. तो हो सकता है ऐसा.
Okay. And if there is continuous tingling numbness in a limb, then what could that be a sign of?
So tingling and numbness has its various reasons. But as I told
Yeah.
you, remember, anything which is sudden in onset. 8 बजे नहीं थी,
Mm-hmm.
8 बज के 5 मिनट पे हो गया. Always think of
Hmm.
stroke. Always. Then
Right.
don't, मतलब it has to be evaluated. Because देखो किसी को डायबिटीज है, न्यूरोपैथी है, तो उनके हाथ पैर में टिंगलिंग
Hmm.
होती रहती कई सालों से. It is not sudden. So anything which is sudden and new, which was not there a couple of minutes back, so it should be evaluated for stroke.
Okay. I am I am actually done with my questions regarding stroke. Okay. Now there is a question regarding epilepsy again by Weber. Are there any special concerns for a woman having epilepsy?
Lots of them, lots of them. So the problem is, if a woman concerns means, I'm not trying to frighten you here, but you have to be careful. If you are a woman with a woman with epilepsy, you have to be very careful for various reasons. One, what medicines she is taking, because there is a high chance that, I mean, if this is before marriage, then when she gets married, and obviously pregnancy and conception, these issues will come. So what medicine she is on, that is very important. Because remember, once she gets pregnant, all doctors will be very hesitant to change her medicines, because it is said that if you change medicines and she has a seizure, वो बेबी के लिए बहुत हार्मफुल हो सकता है, फीटस के लिए, मतलब बच्चे के लिए. तो अगर आप एक लेडी हैं, आपको एपिलेप्सी है, तो आप मैरिजेबल एज जब होते हैं या यू आर गेटिंग मैरिड, यू टेल योर डॉक्टर, योर ट्रीटिंग डॉक्टर. Second, drugs, medicines may have to be changed depending on the pregnancy. Third, medicines can have effect on the menstrual cycles of ladies, females, so that has to be something taken into account. Another thing, women with menstrual problems may take hormonal pills, oral contraceptive pills or hormonal pills every month, and that can have a effect on the levels of the epilepsy medicines. Got it? So अगर आप, let's say you are taking a dose of, let's say 500 milligram, but if you are taking the menstrual medicines, वो 500 का डोज कम हो सकता है आपकी बॉडी में, तो आपको फिट आ जाएगा. तो ये सब चीज़ें रहती हैं कि बहुत केयरफुली ये सब हमें मैच करना पड़ता है. आई कैनॉट, मतलब paucity of time, I cannot explain everything, but yes, a woman with epilepsy is a special case, and it has to be patient has to be in regular consultation with the neurologist and the gynecologist, and the communication between the two is very important. What the neurologist wants to do and what the gynecologist wants to do, so that is very important.
Okay. Kirti has a question. I have a question not related to epilepsy, but I had asymptomatic pain at jaw region. What is the cause?
So, hi Kirti, I know Kirti. So, nice to have Kirti here. So, see, I mean, see, as I said, pain in the jaw region, it can be anything. It can be a दांत का भी problem हो सकता है, but then it can be vitamin D deficiency also. Then it can be nutritional deficiencies also. It can be a lot of things. Jaw region में क्या होता है ना कि it is like a junction of many places. Sometimes ear pain कान के अंदर प्रॉब्लम है पर वो जॉ के जैसा मतलब दिखता है तो माय पॉइंट इज कि ये जॉ इज अ जंक्शन पॉइंट ऑफ मेनी बॉडी पार्ट्स सो यू हैव टू बी वेरी केयरफुल कि कहाँ का मतलब वी हैव टू एग्जामिन द पेशेंट एंड से सो इफ यू हैव अ जॉ पेन काइंडली डू विजिट अस ट्राई टू सॉल्व द प्रॉब्लम am I audible Surbi
Yes, yes,
Surbi
you're
am I
audible.
audible yeah so
Yes, you're audible.
yeah so I think I know Kaustubh also so that's why maybe he has asked a very pertinent question. Yeah, stock market fluctuations, especially what is going on now in the market, where everything is red, 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 and all. I mean, if somebody is following the stock market, they would know it's not a very good time to be in the stock market. But yes, it can be a trigger. Any sort of stress can be a trigger, unless you are, of course, some Warren Buffett or some Rakesh Jhunjhunwala where you're making tons of money. Then I don't think it is a trigger.
Okay. Okay. So the next and the last topic for tonight that we have is dementia. So
Yeah.
now let's begin with what is dementia. Uh, yeah, first with that. What exactly is
So
dementia?
yeah. So the thing is that see, uh, dementia very simple. Many people think of it as only forgetfulness है ना बट इट इज नॉट फॉरगेटफुलनेस ओनली देयर आर लॉट ऑफ अदर थिंग्स डिमेंशिया का एक पार्ट है फॉरगेटफुलनेस बट बाकी भी बहुत सारी चीज़ें हैं और मतलब उसमें जैसे बोलते हैं ना कि खुद का मतलब जो डेली एक्टिविटीज़ नहीं कर पाना जो डेली के काम होते हैं जैसे किसी हाउसवाइफ को चाय बनाना बहुत सिंपली आता है बट शी कैन फॉरगेट दैट नॉर्मल जैसे कपड़े पहनते हैं वो भूल जाते हैं इफ इट इज़ अ शॉपकीपर ही फॉरगेट्स कैलकुलेशंस गॉट इट घर में रास्ते भूल जाना बेडरूम किधर है टॉयलेट किधर है ये सब भी डिमेंशिया का पार्ट होता है बट विल नॉट गेट इनटू डिटेल्स द इंपॉर्टेंट थिंग आई वांट टू टेल एवरीवन इज it is a wrong thing to propagate that dementia is not treatable because there is always a reversible angle to dementia. Now, when patients come to me for dementia, I tell them just one thing कि देखो boss, your age is 85. I cannot change it as of today. There is no medicine to reverse aging as of today. Next year you are going to be 86, not 84. So we can't do much about it. But there are definitely a group of factors and causes which can be treated, which are very simply treatable. And it can be something as simple as a urine infection. It can be something as simple as somebody is on some medications for some other problem. And you stop those medications, their dementia improves. Sometimes, sometimes it can be a surgical emergency. Patient comes with a dementia, and you do a quick examination. He is having some brain tumor. So all this is 100% treatable. So what I mean is, again, with dementia, consult a doctor, take his advice, try to solve all the treatable problems. केयर गिवर का ट्रीटमेंट बहुत इंपॉर्टेंट है बिकॉज डिमेंशिया का जो केयर करते हैं वो उनको केयर गिवर बर्नआउट हो जाता है उनका केयर करते करते क्योंकि डिमेंशिया पेशेंट्स डोंट अंडरस्टैंड दैट इजीली सो स्पाउस स्पेशली एल्डरली वाइफ बहुत बार चिल्ड्रन आर नॉट देयर विद देम so they get frustrated they have depression so you have to take care of the spouse also but with dementia one thing again I'll repeat is don't be disheartened take a proper consultation there are very good treatments available and not only medical treatments non-medical treatments are also available and we offer them in the hospital wherein you are taught dementia exercises which means for let's say for gymming you do physical exercises but for the parts of the brain that have become weak with age we have mind exercises for particular parts of the brain so that also helps a lot and along with that sometimes even depression may present as dementia. I mean, Survi knows it all too well that sometimes there is something called as pseudo dementia. Matlab, because of depression, they tend to have forgetfulness. So it is very easily treatable. You treat their depression, they are fine. So what I'm saying is, don't be afraid of dementia. Dementia means जो हम लोग बहुत बार Alzheimer's बोलते हैं या ये बोलते हैं, ये उसका एक छोटा सा पार्ट है. बट बाकी भी बहुत सारी चीज़ें हैं जो हम ठीक कर सकते हैं, उनका केयर कर सकते हैं.
True, a lot of types of pseudo dementias can be treated
Yeah.
and they are completely reversible. So, if maybe vitamin D deficiency or B12 deficiency is the cause, or maybe depression, depression induced forgetfulness is the cause. So, definitely it can be treated and it is reversible.
Yeah.
Okay, so Dr. Dhruv, what are the neurological types of dementia? Like you first mentioned Alzheimer's, but what other types are also there? And what is the
Uh,
difference?
See, there are a lot of things. I mean, for the sake of the audience, we'll try to keep it simple. But see,
Yeah, absolutely.
Alzheimer's means broadly they forget a lot. But then there are some types of dementia which involve the other parts of the brain, like the frontal lobe, जो आगे का lobe रहता है, which is involved with planning and execution. So then they have executive problems, like they can't wear shirts, they can't do a activity which is a sequential activity. Like let's say I have to make tea. So take a milk, open the milk packet, put it on the stove or the gas, put sugar, put tea, all this. So all these sequential चीजें बहुत बार गड़बड़ा जाती है उनकी. Then sometimes they may have a very rare type of dementia जिसमें they have lot of delusions, and then they are under the treatment of a psychiatrist for many years. But then they have not only pure psychiatric problem but underlying dementia. So all these things are correlated. So there are lots of dementias, but we'll keep it for a later date and we'll discuss it at length when needed.
Yes, absolutely. So I think we can also, I think we should definitely tell the audience whether dementia can be genetic or heritable, and also what can one do to prevent getting dementia.
Yeah. So I think we'll quickly wrap up. What we'll do is we'll dementia can be genetic. Sometimes Alzheimer's are genetic. Alzheimer's में क्या होता है ना कि remember one thing कि अगर आपके family में history है, for example आपके मतलब father को या उनके brothers को उस family में सबको dementia है, या आपके family में young age में dementia होने लग गया है at the age of 30, 40, 50. Usually you don't expect it till the age of 60, 70, 80. So these are also some things you should be careful about, that it could be something genetic, and that is the basic clue. And second thing is, as you told me about what was the second part? I just missed that. Apart from safety,
Prevention.
yeah,
How will
prevention.
one
So,
prevent?
yeah. So see, remember one thing. At the end of the day, dementia is again a degenerative process. So whatever you do to protect your heart and brain, like physical activity, avoiding of all the junk food and cholesterol rich food and है ना, excess of salt.
Basically, everything we advise for lifestyle modification.
Exactly, exactly. And
Yeah.
in addition to that, it is said that people who have a good social life, they can delay dementia because they're always active. And again,
True.
those who are into like reading, mental calculations, solving sudokus, who are active mentally and socially, these people tend to have a very good chance of having less dementia as compared to others. People who are isolated, alone, lower education status, they tend to have more dementia.
Right. Dr. Dhruv, can you quickly take just one question from the audience?
Yeah. Yeah.
Can overthinking and tension cause or intensify dementia?
See, I mean, no, only overthinking and tension cannot cause or intensify dementia, but people with dementia tend to get tense very quickly. That is what I would like to say. Because why this is important is, this is important for husband and wife. Let's say the husband has dementia and the wife wants to convey her point and he is not getting it because of dementia, then they tend to become angry. They tend to scold him. And then that stress can cause them to further worsen, in the sense that they will just it just becomes that they become isolated, they become into a shell, they don't want to get out of it and all these problems. So uh, uh, I don't only thinking nahi hai, aisa nahi hai, but people with dementia need to be handled with care. That is what is important.
All right.
Yeah.
So I think we have reached the end of our session, and thank you, Dr. Dhruv, for this part one, and we'll definitely be back in part two. But thank you very very important information on epilepsy, migraine, strokes, and dementia. And the audience, to the audience, I would like to say that in case if you have further questions, we can you can ask them in the next session, even related to this session. Okay,
Yeah.
there is a comment. I think Dr. Batra is one of the finest I have seen on the show. He's so articulate and precise yet informative. Wonderful. Yes, me too. I second that.
Thank you, Sanjeev. Thank you.
Okay. So there are a lot of thank yous. I think you can keep on flashing that admin. By that time, I'll quickly wrap up. So thank you for accepting the invitation as well and being very brief, precise, and elaborate at the same time about everything. Uh, and at Evrox Healthcare, we actually take care about whatever you think and whatever you feel like. And we also bring on new speakers almost every Saturday for you to know your body and mind more and more. And we'll continue doing that. So you can put up in the comment section whatever you would like us to cover after the part two of neurology. And please like, subscribe, and comment whenever possible. And we have this F1 app coming up very very soon. So Dr. Batra, I think we'll give you a demo of that as well. So if you want
Sure.
certain teleconsultations coming up from this end as well, you'll get
Sure.
many. And so other doctors, you can definitely contact us for the demo and just be on board. Thank you so much and have a wonderful night.
So, thank you so much. Bye. See you.
Bye bye.
Bye.